Hello. First, I'd like to thank Richard and also Sheree for inviting me to speak here today. It's a real honor to be here to be speaking in honor of Gaetano. So today I'm going to be talking a little bit about my journey in ICTD, and Gaetano was a really fundamental part of that, so you'll see that throughout the talk. This is the first email that I ever sent to Gaetano. You don't have to read the whole thing. But had just started in the computer science department at the University of Washington, and I was interested in AI and ubiquitous computing, so I guess that was a good talk for me to follow. And I was really interested in working with him because his research had this kind of impact and scale that I was looking for, and it also had this real human component. The email that I got back, and granted it was to a listserv, but it was talking about the Technology for Low-Income Regions capstone class that Ed mentioned in the intro. This was ultimately how I met Gaetano and Richard and got involved in ICTD. So the capstone project that I chose to pursue and create and test was a project called MultiLearn. The motivation for MultiLearn, it built on a lot of prior work, but the goal was to create a better system for sharing a single computer. So a lot of times education in developing countries, there's not a lot of technology involved in the first place, but when there is, it's usually not enough for all the children to participate. So you end up in this situation where the children are basically crawling on each other to access the computer. So we wanted to figure out how to provide a better means of sharing the computers. So we created MultiLearn, which was a split-screen computer educational game system that allowed each student to have its own, his or her own keypad to participate with their section of the screen, and the content was adapted for their skill level. And they were guided through these activities in math and spelling and a bunch of other activities that we developed. And they could compete against each other and learn at the same time. That was the goal. One of the studies that we did several studies, and we had the opportunity to actually go test this in public schools in Bangalore. I was there twice, and the rest of my group continued on after I graduated for 2 more studies. This study that I was involved in was on competition versus collaboration, and we found something pretty interesting in this study, which was not only did the students actually prefer working together more, which was the system that was already in place, they actually had higher scores on the educational activities that we gave them when they were working in teams. So this really spoke to the fact that there was a system in place, to Eric's point earlier, and there was a lot of value in the system that was already in place, which is when students were collaborating effectively and working together, the outcomes were better and the students actually got a lot more out of it. So what happened to MultiLearn? Failure or foundation is the question that I pose. Obviously, I'm sort of in the camp of the latter. But MultiLearn ultimately was my undergraduate research project, and I didn't stay an undergraduate researcher forever. So I graduated, as did the rest of my group, and we all sort of moved on into other projects, and no one picked this back up again. Again, to Eric's point about success metrics. So our definition of failure, I think, really depends on how we're defining success. We accomplished everything that we set out to do with the MultiLearn project, but ultimately we didn't create a system that scaled to every public school in India or around the world, and we didn't solve all the educational problems. But that also wasn't our goal. So what I learned from MultiLearn really became a foundation for the rest of my work in ICTD. Which brings me to my dissertation work, and a quick note. The one criticism that Gaetano had of my written dissertation, because he was on my dissertation committee, was that there weren't enough pictures. There weren't enough pictures. So I'm going to inundate you with pictures from this work, because that's what he wanted. So my dissertation work was around the PartoPen system, which was a digital pen platform that I developed to improve labor monitoring outcomes in developing countries. The motivation ultimately was the high statistics of preventable maternal deaths, which were largely occurring in these places. In Kenya in particular, which is where I did my dissertation work, the maternal mortality rate at the time was at 488 deaths per 100,000 births, which is really high when you look at places like Sweden, which is 4. The US, I think, is around 20 right now, so still very high. So this was the LiveScribe Echo digital pen that I used as the hardware part of the platform. You can see a couple aspects of the, well, first of all, a show of hands. Has anyone ever used one of these, a digital pen? Okay, good. So there's some familiarity with them. How many people have never seen a digital pen? Okay, yeah. So not super ubiquitous, which we'll get into a little bit later. But pretty interesting technology. You can see 2 to 8 gigabytes of memory, so pretty substantial memory capacity. But the key piece is really the speaker and the microphone aspects of the digital pen. So it can do audio input as well as audio output based on what it's writing and what it's seeing on the paper. Which brings me to how it actually works. So there's an infrared camera in the tip of the pen that reads these microdots, which are printed on the form. And each of these microdots is offset in one of 4 directions, which ultimately gives you these X and Y positions, which act like GPS for the digital pen on the paper. And the dot pattern is unique for every page. So the digital pen will actually know if you're writing on one page versus another. So for the PartoPen project, there was a couple things that I did. The first one was actually changing the form. So this is the Partograph form. It's a required standard paper form for midwives and nurses in maternity wards. And it's supposed to be a graphical record of labor over time. So they plot different aspects of the labor, and it's supposed to help them understand what to do at various times, and also provide a record of the labor in one simple form. So as you can see, the form on the left was what they were using before. It had been photocopied about 1,000 times at this point. And the box is really small. It was very difficult to see. So the first thing I did was actually just recreate the form in a cleaner format. And then added some various audio controls, as you can kind of see down there on the right, for the pen to interact with. And this was the version that we started using when the PartoPen project was deployed. Interestingly, as much time as I put into the software and developing that aspect of it, this simple change was had one of the biggest impacts of the entire project. They said, oh, now I can actually use the form, so I will use the form. And who knew it would have been that simple? Maybe I didn't have to build the pen at all. But I did. And the pen had 3 main areas of functionality. So the first was use instructions. So this was really designed to help overcome training barriers. If they tapped the pen along any of the text along the left of the paper form, they would actually receive audio instructions on how to use that section of the form based on the WHO Partograph user manual in their language of choice. It also provided decision support. So it enhanced the decision support that was already available on the form so that when data was written in these areas, these lines were intended to indicate that action needed to be taken or the progress of labor was going abnormally. However, if you put a mark in one of these areas with a regular pen, that doesn't really tell you much about what to do next. So for the digital pen software, when you made a mark in one of these areas, you would actually get feedback from the pen on some of the next steps that you should take. So preparing for a cesarean section or administering oxytocin instead of just a static paper record. And finally, I built time-based reminders into the system. So often one of the biggest problems in these hospitals that I was working in is understaffing. So one nurse midwife may be taking care of 6 to 10 women in labor. Imagine one woman in labor, and then imagine that times 10, and you're dealing with them all at one time. So it can get a little chaotic and a little hectic, and the last thing you're thinking about is probably paperwork or taking measurements on other patients. And that's where the pen sort of came in. It had patient-specific reminders built in to keep nurses checking on patients making sure that measurements were taken on time and that sort of thing. So I did a number of studies, but I just want to highlight one, which was actually done at Kenyatta National Hospital in Nairobi with 50 nurse midwives, and it was a before and after study. In June, we looked at 194 patient records, and this was pre-PartoPen. And then in August, we looked at 191 patient records, 48 of which were completely filled out with digital pens. So I'll explain that in a minute. We looked at the Partograph completion rates, and we were looking at completion rates. And this is what we found. This is one graph of about 25. But this was the overall completion scores in ranges based on various aspects. So the blue is the August Partographs that were completely filled out with the PartoPens. The red were the August Partographs that were not filled out with the PartoPens. And then green is June, which was also not filled out with the PartoPens. What do you notice about this graph? Little Q&A, little interaction. Wake everyone up. No difference. So normally when people show graphs and they get all excited about them, it's because there's lots of asterisks all over them saying statistically significant, statistically significant. And that's not present on this graph. And the picture that John showed of me illustrates my optimism, but I'm also kind of a worrier. And I perseverated on the shortcomings of this for, well, longer than I'd like to admit. And I remember sending an email to Gaetano saying, you know, like, I don't have any data. I might as well just start my PhD all over again. I might as well just get out of ICTD. And obviously that was not the thing that I did. This is where the quote for the title of the talk sort of just came in for me. He said, technology is going to change. Workflows are going to change. You know, you're not going to use the digital pen forever. It's not going to be relevant forever. What's the thing that you're going to contribute? What's the thing that you've learned from this project that's going to last beyond this study, beyond this dissertation? And so took that advice, went back and kept writing my dissertation and trying to figure it out. And what I realized is what I had ultimately learned was it's about the people. It was about the nurses and the midwives and the patients. And I had been focusing so much on the assumption that everyone else had made about Partograph completion indicating the quality of maternity care that people were getting. And by being there and interacting with the nurses and the midwives, I was able to decouple those things and actually put into question the value that people were getting out of the Partograph in different environmental contexts. So, PartoPen, failure or foundation? Yeah, some people thought that. Yeah, that happened. Anyway, so the PartoPen ultimately didn't continue. I did a follow-up study 9 months later, and all the pens were still there. All the pens were still working. And they had every intention of continuing to use the pens, but the printer had run out of ink, and they were unable to find replacement ink. So this ultimately became the crux of the project. Granted, there was a lot of other things going on, but the PartoPen in general brought more women into Kenyatta National Hospital because of the publicity that it got. They were coming into the hospitals to have their babies there because they knew that something interesting was happening there and people were paying attention. I was on Kenyan television, that's the picture in the right, and I had a chance to stand up on the soapbox and bring attention to the issue of maternity care in these places. Ultimately, it was a success. I finished my PhD, which was my personal goal. But then I also kept getting emails from the nurses and midwives at Kenyatta National Hospital asking me how I was doing, and I was asking them how they were doing. And they were talking about the pride, the increased pride that they had in their jobs because people were coming down to ask them about this technology they were using and how do you use it. And these were doctors coming down to ask these midwives, you know, how do you use this technology? So there was a lot of fundamental shifts. So those asterisks stopped mattering so much to me. However, there was a point where I sort of was feeling again like, but I didn't save every preventable death in Kenya. You know, I didn't prevent every preventable death with this project. I'm starting to get really down about what am I doing in ICTD? There's not enough impact I can make. And I remember sending him an email again, and he said, you know, I'm worried about your feeling. You need to take a break. I hope you aren't burning out. It's too soon for that. It's too soon for that. So I took those words to heart. I kept moving forward. I actually had the opportunity to do some consulting with a company called Damagi on a tablet-based, holistic maternal health app that they had developed and were developing, and got to take all of the lessons learned from the PartoPen and actually integrate them into this new application that was being built, and that has actually been deployed in about 6 hospitals in and around Delhi. And we're starting an implementation of that in Pakistan in a few months. So that was a really good opportunity to kind of take all the PartoPen lessons and really put them into action. In addition, John mentioned earlier inWorks. So I'm now an assistant professor at the University of Colorado in Denver, and helped start inWorks, which is an interdisciplinary institution initiative rather that tries to bring students and faculty in the community together to solve hard problems that matter. I teach human-centered design courses. I teach case studies in ICTD. I run a community Denver Biolabs group that's focused on DIY biology and biotech and how we can take that and apply it to developing communities and other areas that people are passionate about, and really just trying to keep building. Gaetano was hugely influential in this, and really was the motivation for continuing a lot of this work. And he worked until the last day that I saw him. Yeah. So, thank you.
Thank you very much, Heather. That was very good, and I've always really appreciated a lot of the insights coming out of your papers and from your work on PartoPen, that there was always a lot beyond the graphs that really resonated about understanding of workflows, and yeah, I've always felt that it was kind of the next level of depth that you brought out in the work. So yeah, lots of very, very nice stuff. So our